While cases continue to decline, COVID-19 has not gone away entirely. The state still has vaccine requirements in place for all healthcare and emergency medical workers, but some lawmakers are trying to reverse that.
Public hearings for several bills aimed at doing away with vaccine mandates were held today in Augusta. News Center Maine's Sean Stackhouse has the latest.
Testimony heard on 6 bills Monday in Augusta, all aimed at pushing back on vaccine requirements.
Now is the time that we really should be looking back and evaluating what worked and what didn't.
Senator Eric Brakey of Auburn is proposing one of the bills that aims to create guiding principles for how the state responds to infectious diseases, including greater consideration of overall public health.
We've got to not just measure their effect on the one virus we're aiming at, but we've got to measure all of the unintended consequences and harms done to society from universal lockdowns.
Other bills presented Monday, including one to prohibit the inclusion of the COVID vaccine in the state's childhood immunization program. Another bill would prohibit the state from imposing any COVID-19 vaccine mandates for 5 years. 3 bills are aimed at allowing unvaccinated healthcare and EMS workers to get back on the job.
To get kicked off it just felt like a personal injury.
Lori Dobson says she was an EMT on Cranberry Island before the vaccine mandate took effect and testified in favor of revoking the directive that cost her job.
We need to give the people that are just scattered all over Maine and elsewhere a chance to return to the jobs that they worked so hard to get.
Many, however, spoke in opposition to the bills, including the Maine CDC's Associate Director of the Division of Disease Surveillance.
Reinstating these exemptions would result in fewer vaccinations for vaccine-preventable diseases statewide. The evidence is overwhelming, sound, and supported by professional medical community and majority of Maine voters.
They sow doubt in our public health system. They sow distrust in science and modern medicine, and they sow doubt in the professionals that we rely upon to keep our communities safe.
A work session for these proposed bills will be scheduled in the coming weeks. In Augusta, Sean Stackhouse, News Center, Maine.